Please join me in welcoming our panelists for this important session. Dr. Feby Abraham, Dr. Uma Nambiar, CEO, Indian Institute of Science Medical School Foundation and Chairperson, Digital Health India Association. Ms. Alka Goel, founding partner, Alkemi Growth Capital. This session will be moderated by Mr. Vishnu Saxena, founder and CEO, DHN and Scale Health Tech. A huge round of applause, guys, and welcome everyone to the stage.
Good morning again. Great insights, Dr. Feby. Thank you so much for that. Contextualizing, what we can learn from the US and, apply that in the Indian context. That's something, I guess, that's what we need. And vice versa, what US can learn from India. So we look forward to learning more and talking more in our, second half panel in the US perspective. But thank you so much. I think that was wonderful. And I think those kind of the insights, I guess, for the audience is very meaningful. So with that, this is our first panel for the DHN Forum Delhi. Very honored to have esteemed guests with us. You just heard Dr. Feby Abraham. He's an Executive Vice President, Chief Strategy, Innovation, and Investment Officer at Memorial Hermann, one of the largest health systems in the US. And he also runs one of the most performing hospital-led venture fund, which is in the tune of $500 million US. They have invested into 52 companies so far. They have onboarded close to 45 companies in Memorial Hermann. And so Feby is doing a lot of things, believe me. And, and he's also our chief advisor at the Scale Health Tech. So glad to have Feby with you. Alka Goel. Alka Goel, she is the partner at Alkemi Growth Capital. And I'm not going to steal the thunder. I'll just making an introduction, and Alka and Dr. Feby and Dr. Uma, you can introduce yourself. She's based off Delhi, a former McKinsey partner. Feby and Alka have worked together in the past. So great to have Alka with you here on the stage. We're going to talk about how to reimagine India's healthcare from the digital health. And Dr. Uma Nambiar. She is a gem of the person, and she's the healthcare authority. She has led many hospitals in India, building one of the most advanced hospitals at the most prestigious Indian Institute of Science in Bangalore, which is shaping up, is coming up. But very honored to have esteemed guest with us. And what we're going to talk about is reimagining India's healthcare, what it takes to transform India's healthcare when it comes to digital health. And the reason and by the way, we had another great guest, Dr. Devleen JG. She is the India lead for the Google Health. She has a flight to catch, so she just left. So, unfortunately, she's not with us. And the reason we picked these four, now three great guests is to bring the unique perspective. Feby, as a hospital business leader, IT leader, innovation investment leader. Alka, she brings the perspective from the innovation as well as the the VC community point of view. Dr. Nambiar, she is the CEO. She has seen what are the challenges hospitals face on the ground, and we are going to talk about what it takes to do things and how to reimagine that India's healthcare. So you would like to do your introduction, or that was okay? All right. Okay. So Dr. Nambiar, let me start with you. I mean, we call it like technology in healthcare is moving so fast, right? But equity is not, right? We talk about access. We are like 1.4 billion people, largest, most populated country. 65% of the the rural population, we don't have access. In the second half, we are releasing a survey that we did with Chime India that essentially talks about, India's digital health trends and outlook. And also we are unveiling that top 20 CIUs to know. And, when we did this initiative the first time, we were looking for the CIUs, great CIUs, but we couldn't find many CIUs. We couldn't find many VP IT or the GM IT. So the bottom line is hospitals in India don't have the CIUs. They don't have an IT leader. They don't have the driver who can navigate the IT leadership in the enterprise. Of course, minus the top tier 1 hospitals and maybe, tier 2, some of the hospitals. So we couldn't find many CIUs. And here we are talking about the digital transformation and innovation in, the EHR penetration. We don't have EHRs and the /HIS. So as someone who has been into the healthcare for a very long time, you have led the hospitals, you know what the ground realities are, where the India's healthcare ecosystem is growing. In spite of the challenges, we are still doing. What's your take, Dr. Nambiar? What it takes to reimagine India's healthcare?
Extent. Thank you, Vishnu. So this is a very loaded question, and I could spend the entire day, telling you what the gaps are and how we need to fix it. So I would break your question into two parts. One is, when you are talking about digitization, what is the relationship between the healthcare IT community and the healthcare provider? That is one. And number two, how do we take the healthcare system or ecosystem in India to the next level? What is it that we need to fix? So the first part is that we have been traditionally looking at the IT department as department at the basement, just trying to fix your computer-related service queries and nothing more than that. And on the other hand, when we talk in public forums, we talk of digitization and digital transformation. This is not going to bring about the digital transformation. We need to change our mindset, and just for complete digital transformation, we need to look at digital departments as an integrated department of the hospital, more as a infrastructure and not as a service. So we need to really, this is a shift from being considered a service provider to being an infrastructure. Just as a brick and mortar infrastructure is necessary for the hospital, you can no longer run a hospital with just a brick and mortar and having some high-end equipments in place. You need to have the entire ecosystem connected with your digital backbone. And if we do not consider investment in digital as investment in infrastructure, we will not cross the gap. That's my personal view of, this. Number two, about healthcare ecosystem in India as in general. We know that we are considered as pharmacy of the world. We have mastered a lot of things in information technology, and we, considered as leaders in the world. In healthcare provision, in healthcare service provision of treatment, we provide good treatment at very, very reasonable costs across the world. But we are still not the powerhouse in healthcare. Why? Because we have a big gap. We are still not self-reliant. We are still not self-sufficient. Even after, let's say, and the fourth missing gap is research and innovation, which does not happen in India. Unless we do this 25%. So we got the other three right. So if you really put it as, they are not equivalent blocks. In fact, research and innovation is a much bigger bucket to get to self-reliance. So if we are providing healthcare at a reasonable cost today, can you imagine how much lower it can be if we did the big equipments ourselves? So healthcare delivery is 50% of technology. And when I say technology, it is high-end technology. So that's the cost we are paying, and we are importing all that technology. Where are big equipments coming from India? Where is new research model coming from India? We are not having all that technology thing. So that is the biggest gap. And if we are not able to fill that, we will not become the powerhouse in healthcare. And we should aim to become the powerhouse. We are 1.5 billion people, the biggest market size, for healthcare. So if we have this, I think we need to really do that. And to do research and innovation, there are two things that are required. One is huge funding. And when I say huge, it's really huge. India is reaching that stage where we are beyond the survival mode. We have spare change. We can put in research and innovation. We can afford the cost of failure in research. Because research means we have to fail 9 times to succeed the 10th. Or maybe fail 90 times to get into the 91st success model. And that requires a lot of money. We have that. We have a lot of talent, which is right now going out. We need to be able to keep that talent here. Cost of research in India can be far lower than what is in the US. So therefore, we should really focus on that. And second is the mindset of trying to work together. Research and innovation cannot happen by one institute. It requires collaboration and it requires a mindset of co-creation. So I think we need to really, forget about the boundaries. We may have boundaries in our transactions and our finances, but I think otherwise we need to learn to keep our transactional space separate from all other research-minded spaces where we can co-create and collaborate. This is what I would like to share with you. Thank you. Over to you.
Totally agree. I think that, I call it, of course, we have lots of challenges. So there's opportunity. And we see it like opportunity is greater than the challenge. That's where I see it, like tremendous population, tremendous capital. And, we have moved to the value chain where we are not like India, so like 20 years back. So and I think the cultural issues and the willingness and, I think we can change it all. So thank you, Dr. Nambiar. Totally agree. Moving to Alka. So Alka, you run one of the most successful venture fund dedicated in healthcare in India. You left US. You were a McKinsey partner in the New York office. Came to India, started this fund. First, congratulations to you. I mean, it takes lots of courage and a passion and desire to start something and come back to your own country and start those things. Now, and you have seen over the last couple of years in terms of what actually works, what actually doesn't work in the world of digital health startup, the VC community. Now, in a context where things are not as smooth, whether it's a hospital's EHR, the tech workforce, the ABDMs trying their own things, the investors are, the startup, but the startups are, they are building solutions. They are building solutions. So innovation is not stopping. How do you see what the current ground situation, where the investment is flowing? What is the pulse of the investors, in investing into the digital startups? And from the startups point of view, how they are doing? So can you enlighten the audience in terms of what is a VC's perspective and what you want to see from the startup community as you want to reimagine the India's healthcare?
Sure. Thank you, Vishnu, and amazing gathering here. And thanks for your time on Saturday. Very big questions I must ask. And I'm seeing the clock. It's 33 minutes. So to discuss all of that will be infeasible. But let me start by giving you the basis of my perspective. We started Alkemi Growth Capital in 2018. Since then, we've met close to 2,500 healthcare startups, which is a very, very large number. And of course, we define healthcare very broadly than just healthcare delivery. Vishnu, you said something very right. People are innovating in digital healthcare, but we haven't seen scale. And that has scared some of the investors. If I keep the healthcare definition only to healthcare delivery for right now, because we include pharma and devices and diagnostics and biotech, I'm excluding that because that becomes a whole different topic. For every part of the hospital workflow, there is a digital solution. Be it patient acquisition, be it patient retention, patient engagement, monitoring, emergency care, workflow management, financing. And I would sort of support a little bit of what Feby said, and probably the friction. If you look at the hospital system, it's government and of course private, but within private, there are few chains, and then there's whole promoter-led individual sort of smaller nursing homes, and of course charitable trusts and things like that. The decision-making for them to adopt new solutions is actually quite slow, very risk-averse. I can give you an example. A founder trying to sell a solution to a hospital. It takes, let's say the founder is based in Bangalore and they are based here in Delhi. First, there will be a clinical meeting, not once because two doctors are not available. Then there will be a compliance meeting, a data meeting, a medical guy meeting, a procurement meeting, the IT meeting. The guy, if he has to come to Delhi 8 times, he's already spent 4 lakhs or 5 lakhs, and then all he gets is a pilot. And that too with so much suspicion. And the outcome is, hey, it's all about cost as opposed to value. So I think hospital, there are solutions for every problem, whether it is in the ICU, whether it is nurses. I mean, literally, one of the hospitals adopted a 5G ambulance, which was launched just the other day. One of the hospitals I was visiting, patient feedback through QR codes. But it just takes so much time to convince the number of stakeholders. So I'd like to borrow an idea from what you have done, Feby, is actually create a little bit of a lab which allows startups to build with you fast pilots. It's not going to be perfect. It's not going to be an IBM-like solution. They don't have the sales resources. So many startups have literally failed because they can't complete the BD cycle. And it's very, very hard for us to then fund it. So it's not because ultimately our shareholders are looking for return. So if you look at the, lot of few health tech startups, especially in the provider space, will ever come up with the top 10 because the enterprise sales process, if I had to be there, I'd just tear my hair out. So my question to the decision makers in the providers would be, hey, what can you do to assist the digital adoption of these young startups? They come with a lot of hope. They're willing to do a lot of things, but help them have an open mindset.
Can't be more agree. And I think, while the solutions are there, it is the cycle. It is the kind of like, they don't see the light of the day. And the term, like the start of funeral has started, or, the death by pilots. So it is real. And investors and everybody has a certain level of patience. they can go up to the certain level. And I think, but even in spite of all these things, there's a hope, there's a silver lining, and there are investors. There's a Alkemi, growth capital. But to your point, Alka, I think that's very important, and I think we will talk to some of the CEOs of the hospitals that we have, and how we can shorten that cycle, speed to innovation and time to value. These two things are very important. So totally agree. Now, moving to Dr. Feby with you. So you are in a unique position. You have multiple hats. You are a chief strategy officer of one of the largest health systems in the US. You see innovation, you see investment. When you see India, and when you see the business leader, when a hospital CEOs, and from the business point of view, and from the policy point of view, what is the one thing that you see they are not doing or underdoing, or where the strategy is missing when it comes to a hospital CEO point of view? What they should be doing so that, to Alka's point, they can bring outside-in solution, and they can see the real tangible outcome and be more consumer-centric organization.
So I'm going to be somewhat provocative on this one. I actually think this is a problem in the US too. I think there is a real dearth of real leadership, not at the CIO or CDO or CSO level, but I'd argue even at the CEO and the board level, in understanding what digital is. And let me sort of expand on it, right? Like, I totally agree with your comment that, Dr. Uma, about the need for digital and technology to be part of the spending. But they think about it as spending, and they don't really understand, I think, and requires a real education of where value is created. And I think it's important for first the C-suite to go through that sort of immersion to sort of really bolster their leadership on this front. How's value created? You're creating, Alka, you touched on a few of them, right? There is one of it is you can improve your market share by either better patient acquisition or retention. You can have an expansion into new revenue streams, whether moving away from hospitals into expanding access to rural communities, or going into pharmacy, or going into home health, going into other sort of, behavioral health, high quality specialty care, some disease management programs, etc., etc. You could have an efficiency gain either through improving the time that your doctor spends with the patient or the nurse spends time with the patient, and therefore improving the number of patients they can see, or and there are other value creation drivers. I don't want to go through the whole of it. There could be supply chain value drivers, etc. But I think it's important to sort of connect enterprise strategy to digital so that digital and enterprise strategy become woven together. Once that is happening, the CDO and the CIO's role can become much more elevated. I don't have to go and then say, look, give me a $1 million check to sort of run this. Then I become, okay, I have an enterprise strategic goal to sort of touch 2 times the number of patients that I'm touching in the next 5 years. How can digital enable that? So I think that's, to me, the first element of, I think, a real change that can occur in India, but also in the United States. We're still sort of ways off and sort of catching up to that wave. So that's one. The second is, I think, taking a very data-driven methodology to sort of understanding where the real gaps are and framing a lot of the problems. So before I meet any technology startup or otherwise, I need my team to articulate what is the problem we're solving. So there was a slide I glossed over. We have met with, more than thousands of companies now in various problems, but we've sort of first started with about 80 unmet needs or pain points we're trying to solve. So articulate what is it that we're trying to solve. And then I use the analogy of hammer in search of a nail. Every time we meet a company, we have to be very clear, okay, that's the problem you're trying to solve because it's connected to enterprise strategy. I'll give you a specific example. Houston is very bad, or Texas in general is very bad in terms of maternal mortality, which you'd say, look, you're a first world country. Shouldn't even maternal mortality occur? Why is it occurring? And so we dug into it. And we found that it is dominant in high obesity, high blood pressure patients, which are highly prevalent in the South. It's because the demographic mix. A lot of African-American women, in particular, Latina women in particular. But so unless we understand what the root cause of the problem is, we can't find a solution for it. So we have taken an approach to say, look, we're not going to treat every person the same. When we think about equitable access, when we think about the problems, let's sort of go into the nuts and bolts of it. So those are the 2 thoughts and there's multiple more, again, to Alka's point on time, I don't want to spend the whole day talking about it, but those 2 headline thoughts about really thinking about reshaping leadership, education, and value creation, not cost, and then taking a data-driven approach to how you frame the unmet need and pain point before you talk about AI or digital would be the 2 unlocks, Vishnu, to answer that question that you had.
Sure, absolutely.
So in, line with what you said, the problem here is the CEOs, a lot of them might understand, but what they lack is how do they parameterize the value creation by a tool to convince the investor? Because value creation is just English. But what they need is some objective data where we can say that, okay, this is the ROI. So can we have a tool that you can create perhaps to create that subjectivity of value creation into a hardcore data of ROI, which is easy to convince the investor?
Totally agree. And just to pick up Feby, your point and Dr. Uma's point, when we call it reimagine India's healthcare, I mean, it takes, the entire leadership of the value chain, whether it's a hospital, whether it's a policy, technology, startup, everybody has to come together. Now, and I want to be really practical, forgetting about like this, like the top cities and top hospital CEOs. Do you think there is a, lack, as you mentioned, what does digital transformation mean for a hospital which is the tier 2 city? The CEOs of that hospital, do they have an understanding and appreciation? Let's say a hospital in Nasik, let's say a hospital in Kanpur or Ajmer. I'm just trying to, think tier 2 cities and imagine couple of diagnostic centers, imagine couple of nursing homes there, imagine like 2-3 hospitals small. They have the reverse problem. If they open more nursing home, I think that will also fill up quickly. But then when it comes to engagement, experience, and data-driven, I don't know if they are. And right now, they are living in the world that the patients are coming to them, but the things are going to change really quick. When the patient value the experience and other things that we'll talk about in the next panel. But, I wanted to touch upon, Dr. Uma, that if you think that if there is a greater understanding among the CEOs of the hospital from the tier 2, tier 3 cities, that digital and IT and the technology is actually going to make their hospitals better, the patients happy, the margins better, do you think they will understand it?
Actually, post-COVID, a lot of this has changed. And I think a lot of them understand. I would say more than 9 on 10 people understand that this is a need. Now, it is about putting all the pieces of the jigsaw together to say what is in entirety the digital transformation that they should be looking at. Do they understand that the systems that they are buying, do they understand what is the right system for them to buy? Right? I mean, a hospital, let's say a 250-bed hospital in a tier 3 town, does not have to buy the HIS and EMR that is bought by Fortis and Medanta. But what happens is because they have the money and they do not have the knowledge, they'll end up buying something which is actually a shoe too big in size for what they need. So I think the education on, and like what you said, digital health portal, you want to create something where you can have a digital health marketplace where somebody can go and say that, okay, this is the right fit. I think that would make a difference because you need to help them. See, the younger generation that, is born with a smartphone in hand rather than, like as a toy to play with is different from our generation, people who are currently running the hospitals. And I think they need education. None of us were born with this kind of education. We were not taught. So we have to self-learn and we have to use forums like this to learn. Creating a digital health marketplace, I think, is the right step to, like during COVID, we created a telemedicine registry to help doctors and the hospitals decide based on their size and their need, which telemedicine solution is the right thing for them. So similarly, I think that should be done.
Great. Thanks for validating that. Alka, again, Feby touched upon like equity and, of course, how to unlock that strategy piece and reimagine. Now, from your experience, when you see Indians' healthcare, where do you see when what is the most overlooked piece in health equity is? Is it like income, gender, socioeconomic stuff? How we bridge that gap that we have, between the haves and don't haves through digital health?
I think that there are many, many questions roped into that because for me, I like to build on what Uma said. I think it's less about HIS and EMR. I feel like digital health somehow is reduced to that. I really want to talk about patient care. How do you elevate patient care? If you look back, today patient is aware, through internet, they are aware, they've already Googled a lot, whether it's right or wrong, and AI will make information more commoditized. So the patient is getting smarter. So is the physician, the information is available. How sensitive are they to care? For a minute, I don't even care about efficiency. I am actually caring about patient outcomes because if you look back 10 years back, there was no infrastructure. There's no X-ray machines in these hospitals. There was no doctors. There's no talent. Or they're trying to overdiagnose. They're trying to oversell. And as you said, 40 different. So I actually don't see digital health as an EIR, EMR problem, which will happen with time, needs to happen. HIS billing. And frankly, it's in the best interest of the provider to do that, even from a financial flows. I'm talking about how are clinicians using digital health to improve the patient care. Again, there are solutions, e.g. in ICU monitoring, e.g. in ward monitoring, patient monitoring, educating people. I don't think those solutions are being used. And you talked about inequity. Frankly, I've seen great hospitals in Nashik, and I've seen really bad hospitals. It because such a large percentage of the hospitals are run by individual clinicians, it's actually very variable. Of course, there's the infrastructure problem and lack of talent. So I see inequity not at a city level. Of course, Delhi is a hub, Nagpur is a hub, you've got Raipur beginning to be a hub, and all of these places. But you got some great care. I mean, in Tamil Nadu, in Kerala, some amazing hospital. But at the same time, there are enough hospitals that are just guided by the wrong practices, which is what needs to be called out.
Yeah, I think that's a big gap. Even among the hospitals, there are great hospitals, and there are like the hospitals which are really, really, not up to the level. Thanks, Dr. Feby. Innovation, hospital-led innovation, and I think and of course, the US much mature, and hospitals have money to invest, and there's a willingness, there's an infrastructure, there's everything is right there, and still there are challenges. When you see India, even if you see the top hospitals, do you think there is a time, it is the time now, or maybe in next 1 year or maybe 2 years, they should start thinking in terms of developing the culture of innovation internally, where the startups in Alka's portfolio, they can have them from the outside in solution. They can invite them that, hey guys, come on, we are looking at these many areas: engagement, access, data analytics. So do you think the time is now for the Indian business stakeholders, the hospital CEOs, and of course combined with the CIOs, they should start thinking about how they can build a culture of innovation within the enterprise? Because there are lots of sandbox and integration, those things are happening, but it's not going anywhere.
There is. The short answer is yes. Now, I think the question goes into the how, and that's where I think, Uma, the point you were making, CEOs, I'm glad to hear, are very aware of the value creation drivers. I think there's got to be a two-sided education on how you translate specific ideas into value creation. Some of the ones that have been, for example, in telemedicine have been easier to sort of explain, because I think that there the value creation is about expanded access and reach. I think where it becomes difficult and more interesting, Alka, to your point about a lot of the companies trying to sell to health systems, which I believe is a tough game, is to sort of educate the other concepts of value creation and elevate them as part of the ROI thinking. So I'll give you an example. We invested and partnered with a company that provides cancer care at home models. And I'll explain why that's pertinent and apropos to the discussion. What we saw immediately was that, why does an oncologist care about a cancer care at home model? The real problem is we have, for all the cancer care patients, the time it takes to see an oncologist is very high, because the supply of oncologists relative to the demand of cancer patients is skewed. So we thought that by providing a solution that provides cancer care at home, you're reducing the capacity or increasing the capacity of the oncologist to see more new patients, and therefore reduce the wait times, and therefore expand the number of patients that they can see, number one. Number two, when we ran the pilot, we saw that the emergency room usage in the weekends came from about 15% to 2%, because they could call this hotline, and many of the problems were addressable purely by the nurse on call, or through sending an urgent visit. The nurse would go to their home. They don't have to come to the ER.
Right.
So we were able to take a lot of those two value prop drivers to explain how it reduces costs, improves access, and does a lot of ROI thinking, and therefore drive that to scale. I think if we could sort of educate not just the CEO and the CIO is important, but everybody else, like the CFO needs to understand this language.
Right.
The CSO and other people, the business leaders in the hospital, like the first pushback can come, why are you taking my patient away to some other model? My economics and incentives are in having that patient come to the clinic. Why are you taking this patient away? To explain that requires a full cultural transformation. And I think the CEO needs to be at the vanguard of explaining all of that, and he needs to have the champion. So I think it's easy to say, yes, I need to invest. But I think the building blocks of how value is created, and I agree with Uma's point, it can sound like management gibberish, but I think to truly break it down to the grassroots levels and make everybody understand how all of these things work is an important component. And that was one of the things that we went through at Memorial Hermann. It took a village. Initially, when we ran the hospital at home program, for example, some of our hospital CEOs pushed back and said, why are you taking our patients away? And I said, look, these are low acuity patients. You are supply short anyways. I can give you a better patient to sort of fill that bed. And now you both improve quality and outcomes for those patients, but also those patients who are low acuity who are now at hospital at home program. And so they said, that gets it. And then we also said, we'll translate some of those patients back to your hospital, so you're keeping the P&L. So how do you translate a lot of these value creation drivers and make it understandable to the specific operators is an important thing, and the clinicians need to be bought in.
Yeah, the entire, the leadership, whether it's a clinical, operational, technology, led by the CEO, and make sure that there's a clear understanding in terms of, what we are doing and why we are doing it and how we are doing, right? And the culture of innovation then translate on the business and the patient outcome. We got 2.5 minutes. It's a rapid fire. So you are sitting in 2030, 5 years from now. DHN Forum will be much bigger, guys. 2030, DHN Forum. One outcome through digital health that you envision that you have achieved. What would be that? Dr. Uma, you please start.
Bridging the trust deficit between every stakeholder in the healthcare ecosystem. Using technology to empower everybody, work together, and trust each other.
Mm-hmm. Very interesting. Absolutely. Trust is the quintessential. Alka?
Outcomes and experience. Sorry, I'm just going to double click on that trust, because improving patient outcomes and experience, because today every patient thinks this hospital is out to fleece me.
So true. Can't be more agree. Dr. Feby, what's your take? You are in India.
Yeah.
In 2020 India.
Actually, I love cars. And when electric cars and smart driving features came in, I said, I'm going to be the last person who moves from an internal combustion engine to an electric car, and I'll never use smart driving. I'm wrong on both those fronts. I don't still have an electric vehicle, but I understand smart driving enough. So I feel like in 2030, the trust that you mentioned of what an American driver has towards smart driving features will happen in healthcare. And to do that, a lot of the infrastructure will get built. We were skeptical of all those things in driving back then, but it's becoming a reality now. You come to Phoenix and San Francisco, in particular, two cities, you'll find these cars run by Google Waymo. They don't have a driver. They're like an Uber without a driver. And you can go into that car. It's like, it's an Uber service, but there's no driver. People trust it there. Can that not occur in healthcare? 2030 India, I think that's the art of the possible.
Awesome.
I think India should lead the concept of smart healthcare for the world. That's a possibility we have, and I think we should work to it.
I think we have a tremendous potential. We just got to do it. That's it. So round of applause for the amazing panel. Terrific insight, reimagining healthcare through digital health. So thank you, Dr. Uma, Alka, and Dr. Feby. Varsha, back to you. Yeah. Guys, we have, though we are, we just finished on time, but in the essence, if you have any question for our great speakers, please speak. We'll take just one question, real fast. We'll make it two.
Hello, I am Anusha. I am a data scientist, and kudos to the points raised in the panel today. I think I really want to hear your views on how we can have a way in which patient data is collected that can help in clinical studies, because I don't know if I mean, my experience of a year working in a hospital shows that patient records are not even kept, leave alone being in a form that can be used for modeling or analysis. And I think if digital health includes that aspect of research as well, so that we can use these models to inform, India-centric drugs and care, not just standardized on US standards. I think that's like a big leap that must happen. Thank you.
So there are 4 words in which I will answer this. Interoperability, followed by de-identification of data, creation of data sets which are indigenous to Indian population, and making it open access for researchers.
I will just fully endorse all the right checkpoints.
I think the
You can
CEOs
expand it up into sentences.
the CEOs have to make that happen as well, right? I think that's
I think that is it, because there are solutions who can do it, but it costs money. Now, if it's costing money, it affects the EBITDA. If it affects the EBITDA, you cannot get it approved at whatever board management level. So CEOs are largely only interested in solutions.
So
which are-
CEOs work at their own hospital level. Interoperability should be mandated as a standard guideline by the government so that happens. Creation of data sets. There are research scientists who actually can create these data sets for Indian population with these de-identified data sets, which are made available through a government platform or hospitals that can run on that platform, which want to do research. And
So in the US, we've actually created this whole concept. The company is called TrueVeta, by the way, you should look it up. We started it about 5 years ago. It was a consortium model across health systems. And health systems, I think, can be at the vanguard of it because we have a lot more data than anybody else. But we never used that, to your point, in clinical studies. So what we did is we said, let's all come together. We'll bring de-identified data, and sort of this company became an analytics engine for us to create that sort of cleaned, de-identified data that then is provided to the pharmaceutical and biotech company to do their research. For them, the biggest cost driver is patient recruitment.
Right.
And so if you get more personalized data, which sort of guides them to the right patient, then they can use that for clinical studies, but also later in health economics, outcomes research, and even clinical research. So that's perhaps a model that can be applied here, consortium models to drive clinical research.
IIC, we are planning to do, all pieces of the, puzzle together. And that's why I said right in the beginning that we would like to collaborate with everybody. This is not something that is going to be we will create it, but it's not entirely for our use alone, but it is going to be open for research scientists across the country.
Great.
Fantastic.
Thank you. I think we are up. So thanks for the question. We'll look forward to engaging with you and answer your questions in the audience section. Thanks. Round of applause.